Hello, thank you for taking the time to listen to this presentation about my problem of practice. The title of my problem of practice is Examining Health Insurance Literacy for Employer-Based Health Insurance Education. In an article by Greenwald and Fronston, a quote really stands out. More than 1/3, 37% in this case, of employees indicate that their employer or benefits company provides no education or advice on benefits. Most insured people in the United States under the age of 65 are insured by an employer-sponsored health plan, creating an urgent need for education and acknowledgement of barriers in the work sector. Many employees report being satisfied with the health plans offered by their employer. However, research shows that they do not understand the key terms and concepts needed to effectively choose and use a health plan. Health insurance terminology and concepts are complicated and require various competencies for comprehension and application, and many individuals face barriers leading to stress when it comes to effectively using health insurance. Health insurance literacy measures the degree to which individuals have the knowledge, ability, and confidence to find and evaluate information about health plans, select the best plan for their own or their family's financial and health circumstances, and use the plan once enrolled. The issue of low health insurance literacy was explored through the examination of existing literature, uncovering that while education exists for the public sector, the work sector has not adopted a health insurance literacy framework due to the lack of research. When it comes to HIL education, the stakes are high. The findings from the literature review, as well as evidence presented from this case study, further the conversation which began in the public sector. This issue is important to me because I value education, and as a human resources professional, I've seen firsthand just how empowering education can be, providing autonomy and the ability to take action. This type of organizational change promotes a culture of trust and respect, improving the employee's experience, their family's experience, as well as having a positive impact on the community. This study exposes gaps in the health insurance literacy of a group of employees working at a large nonprofit organization in Denver, Colorado. The primary research question that guided this study was, what are the health insurance literacy gaps in the workplace? By providing evidence for this question, the first goal is to provide employers with a better understanding of what employees struggle to understand. Employers need research-based information about subscribers of employer-based health insurance plans to design effective HIL interventions. The first sub-question in the study is, why are health insurance benefits difficult to understand? Employee benefits research provides employers with feedback for existing benefits communication interventions. This study provides guidance for considerations when designing a robust HIL initiative that employees can understand. The second sub-question that further guides the study is, what factors contribute to or are barriers to health insurance literacy? More research is needed to continue to uncover barriers, and this study's questionnaire and interview provide emerging themes for common barriers through the reflection of past experiences using an employer-sponsored health plan. Next, I would like to talk a little bit about the methodology for my study. I chose to conduct a qualitative case study design, and I chose this method because my research questions required a current snapshot of health insurance literacy from the perspectives of diverse individuals within a group experiencing the same education initiatives through a shared employer. Creswell and Poth defined case study research as a qualitative approach in which the investigator explores a real-life, contemporary bounded system or multiple bounded systems over time through detailed, in-depth collection involving multiple sources of information and reports a case description and case themes. The case study was constructed using two phases. In the first phase, a questionnaire asked participants to answer questions about health insurance terminology, cost scenarios, and past experiences using employer-sponsored health plans to shed light on gaps and barriers to literacy. In phase two, semi-structured interviews allowed for a more in-depth discussion around perceptions about barriers from participants. The theoretical framework for the study was transformational learning theory. which poses that an adult learner must examine past assumptions related to experiences to put new knowledge into action. This theory, often applied in human resources, aided in the identification of emerging themes from the findings. Data from the questionnaires and interviews was read, coded, analyzed for themes and descriptions, synthesized, and interpreted. For both phases of data collection, a spreadsheet was created to track codes and themes in order to increase the visibility of patterns. My life experiences, race, gender, and more have undoubtedly shaped my opinions and biases regarding HIL, and I kept this at the forefront. Participants for the study had access to the organization's benefits guide and were each members of the Human Resources Department. Each member of the department agreed to participate in the questionnaire, and demographic diversity was used to request participation in the interview. Overview of the findings. So this tells a little bit more about the findings from my Phase 1 questionnaire. Again, Phase 1 was the questionnaire and Phase 2 was the interview. The questionnaire was broken up into 3 sets. The first set provided demographics questions. Demographics questions related to race and ethnicity, native language, and age. In set 2, multiple choice terminology and cost scenario questions were asked. The main terms to come up that were most missed were health maintenance organization, or HMO, coinsurance, and out-of-pocket maximum. And 47% of participants answered these questions incorrectly. But perhaps the most alarming question that was missed by 79% of participants was the calculation of the cost of a healthcare scenario. Set 3, open-ended barrier questions. 53% of participants reported experiencing barriers to health insurance literacy. And 37% of participants delayed seeking care due to health insurance literacy. Phase 2 was the interview. 3 themes emerged from the interview phase. The first one was experience matters. The second was improved benefits materials and communications are needed. And the third was that cost barriers did indeed exist. Now, I wanted to tie my findings, my emerging themes, back to my theoretical framework, which was transformational learning theory. Transformational learning theory poses 3 meaning perceptions. Epistemic perception, which causes one to believe that a situation is out of one's control. Sociocultural perception, when an individual does not engage in critical thinking or does not have access to information and falls victim to a belief system. And psychological perception. The involvement of trauma responses can inhibit the development of new knowledge. For epistemic perception, some of the key phrases or concepts to come out of both phases were that health insurance terminology and information regarding cost of services is too confusing to understand. Fear of shame and embarrassment is an experienced barrier. For sociocultural perception, some believe that hierarchies exist for health insurance subscribers and that healthcare has become highly politicized. Psychological perceptions or distortions included past experiences dealing with financial burden or inability to pay a medical bill, and even feelings of shame for asking questions. Next, I want to talk a little bit about the implications of my study, the so what. There's an urgent need for HIL education within the workplace across all demographics, and this will require organizational change in many organizations. The shared services umbrella of human resources, which typically includes benefits, compensation, payroll, HRIS, they must put education at the forefront of initiatives. A health insurance literacy training policy should be developed and implemented so that change in leadership or human resources roles does not impact the existence of a new HIL program or existing HIL program. Education should be developed using research-based data. Training should include health plan scenario application in small groups using the organization's plan, coinsurance percentages, deductible amounts, out-of-pocket maximum amounts. The organization's benefits guide should be available during the training and after so that employees can refer back to those materials. The study provides evidence that experience using health insurance matters when it comes to health insurance literacy, and training should leverage cultural capital and allow for knowledge sharing based on experience using health insurance. Facilitators should allow time for conversation and questions and provide contact information for the benefits team. The underlying framework for trainings should be transformational learning theory. Perceptions must be addressed through the examination of past assumptions to break down distortions and current belief systems. Distorted perceptions are currently holding employees back from increasing health insurance literacy. Future research should also be conducted and designed. Given access to validated training measures, legislation should be created to ensure that organizations providing an employer-based health plan provide access to health insurance literacy trainings at least once a year. As for the distribution plan, so how do I get this information out? The distribution of findings from the study are targeted for employee benefits professionals and human resources leaders. This case study provides leadership of organizations with the evidence needed to promote organizational change and increase employee health plan education. Human resources professionals specializing in employee benefits will gain more insight into the gaps and barriers that employees experience relating to health insurance and will be able to proactively address this issue. There are two methods of distribution for this research. A professional presentation for key stakeholders was conducted by myself and Dr. Tony Talbert at the Health Benefits Conference and Expo in May of 2021. This is a leading conference for employee benefits specialists and other human resources leaders from across sectors and qualifies for a credit towards the SEEB certification. It was crucial to present this study's information to this audience because of their vested interest in employees' health plans, along with the impact that they have on their employees' health insurance literacy. The second method of distribution is a 1-hour presentation of findings for this human resources leadership team at the organization that provided the participant sample for the study. The presentation covers the definition of HIL, current research in the field, recommendations, and for distribution materials. Both presentations required materials that could be used as resources following the presentation. A PowerPoint was developed and distributed to session attendees at the conference. The presentation for the human resources team included a handout with key points from the study, as well as an executive summary. I've included a few resources that had a major impact on my study. And I want to say thank you again for taking the time to listen to this presentation.